Cardiopulmonary Resuscitation by Natalie Shin and Megan Nugent.
475,000 Americans die of cardiac arrest annually. 90% die from cardiac arrest before reaching the ER.
7 in 10 cardiac arrests happen at home.
Seeing that CPR is the leading treatment for cardiac arrest, it is important to know how to perform CPR properly. Before starting chest compressions, check the scene for safety and use PPE or personal protective equipment. Some factors that would make a scene unsafe include traffic, fire, or falling masonry. Ask them if they're okay.
Are you okay?
If there is no response, check the victim's pulse and check for breathing. If the victim does not respond and is not breathing or only gasping, call 911 or tell someone else to do so. In children and infants, only use CPR when they are not breathing normally or responding.
Call 911.
Before starting CPR, place the victim on a flat surface. In order to perform chest compressions, open the person's airway by tilting their head back. Place the heel of your hand on the person's sternum, interlocked with your other hand that is on top of it. Make sure your elbows are locked. Then press down and perform compressions at least 2 inches at a rate of 100 to 120 BPM. Do 30 of these compressions, then move on to giving breaths. Make sure the airway is open and ensure that the breaths you give last about 1 second and make the person's chest rise. Continue this until the person regains consciousness or until the EMS arrives. To remember these steps of CPR, recite the acronym CAB. Restore the blood flow through compressions, open the airway, and breathe for the person. Compress and recess to success. As soon as one is available, whether that be before or after chest compressions, use an AED or an automated external defibrillator. Follow the prompts that are given.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Apply pad to bare skin.
As the shock is delivered, make sure no one is touching the person. Then repeat the CPR compression process. And again, continue this process until the EMS arrives. There, you saved a life. And remember, compress and recess to success.
Thank you so much for saving me. Of course, it was my pleasure. Whether you're my mother, staying alive, staying alive. Feel the city breaking it up, everybody shaking it, staying alive, staying alive. Staying alive. Oh, staying alive.